Okay, Mike Masato, CEO of Staff Driven Dental and the Dental Road Warrior, returning for episode 37 in the series. Today I want to talk a little bit about setting expectations. I think a lot about our coaching has to do with it, as a leader in your practice and an owner in your practice, going in there and setting expectations. But this also is important on a clinical level in your practice, whether it's coming from you, either your hygiene department or any other clinicians you have in your office. It's important to set expectations when it comes to something called the standard of care in your practice. We all have a standard of care as a clinician, or at least I hope you do. It's in our head, and we approach patients based on and how we're going to treat them, and make treatment recommendations and sell them treatment based on what we think is optimal for them and our standard of care, and then we present treatment based on that. Now, again, the problem with this is that most of us in the practice, or most of your staff that work in the practice, don't understand what exactly it is your standard of care, and it's all a little different for everybody that's there as well. And this really impacts your patients getting what's best and the optimal treatment in their practice. And one of the things I always teach that you must have a standard of care is you have to sell to your standard of care. So whatever that standard of care may be, and I'm not telling you what it should be, you have to make sure that every day when you're in your practice and you're speaking to patients about treatment and you're selling treatment to patients, that everybody there is selling to your standard of care. In other words, if we're starting high and we start with optimal care, we can always settle for less, but we don't present below our standard of care and settle even lower than that. All right, because at that point, not only is our patients not getting the best treatment possible, financially, you're not going to be doing very well either if that's the way we are going about in our practice every single day. And unfortunately, with insurance the way it is today, and dealing with that all the time, we have a tendency to gauge our standard of care or make our standard of care be about what the insurance will or will not do. And unfortunately, this is what patients do. You want to know why our health in America is failing, not only in the dental field, but in medical as well, too, is because people are putting their health in the hands of insurance companies and making them make decisions about their health based upon insurance, which is why we're in the situation we're in. So we're dealing with this every day in dental practice, with people making health decisions or not based on their insurance coverage or not, which is not a good thing to do. All right, so ultimately, as a foundational thing, you need to have a standard of care in your practice, whether it's for your hard tissue approach in your practice, and also for soft tissue management as well. You need to have both. These need to be fleshed out, put on paper, decided upon, put into policy, and again, we all approach our patients this way. And our patients need to know our standard of care as well too. You can talk about your standard of care with your patients, because they have no idea what your standard of care is, and you need to discuss them about that we are an optimal care, meaning we approach all our patients with all the best possible options first. I had a dentist a long time ago in Connecticut that we were coaching many years ago. And he took this to heart so much that he took over his office. He used to bring people into his office, which doubled as a treatment room, presentation room. And he had a big sign made over his office door. And it said, in this office, we give every patient every opportunity to reject all the care they really need to get. So what he was saying is basically, look, I'm going to present it all. I'm going to tell you what's optimal and best possible for you, and you can reject it and not get it if you don't want to do it. That's in your hands. But I'm going to present what I believe is best for you, regardless of your financial means, insurance, and everything else like that. Because at the end of the day, your health is a priority to us. All right. Again, and patients, don't understand this concept, and they accept the lower standard of care these days when it comes to their health. And you need to enlighten them. That's not how we go about doing it in our practice. All right. So whatever your standard of care may be, you need to decide upon it, and that have every provider in your practice approaching your patients with optimal treatment presentation every day. Now, again, and if people don't want to be on board with this, then maybe not a fit for your practice. This can cause a lot of problems and a lot of confusion, a lot of upset in your practice if everybody's not on the same page with this concept. Let me give you an example. This whole idea of really developing a standard of care came out of a meeting, a classic story also of many years ago, and I was coaching a practice in New York that was in transition. And basically, it was a younger doctor, maybe 30 years old at the time, who was taking over from a doctor who was in his 70s. And they were 50-50 partners at the time, and he was taking over the practice 100% soon. And he had a three hygienists. They had a hygienist that was in her 60s, a hygienist that was in her 40s, and a hygienist that was in her late 20s, who were all presenting and going about hygiene and in different ways in the practice. So there's a big blow up happening at a staff meeting one day, argument about why treatment was not getting presented and accepted the way the young doctor wanted it across the board. And it was an interesting phenomenon from time to time that one doctor would present some treatment, walk up to the front desk, the other doctor, the older doctor, would walk up and say, no, you really don't need that. We can do it this way. And he would unsell the treatment. The patient was already committed, and he would unsell what the younger doctor wanted to do because he had a different standard of care in his mind. And I can tell you his standard of care wasn't as good as the younger doctor. But this was also going on in hygiene as well, too, because, again, periodontal disease was rampant in this practice. We had discovered that it was really out of control. But we are having this big, blowout at the staff meeting, and I said, well, anybody want to tell me what the situation is here that's causing all these problems? And there was a big silence, and until the young hygienist spoke up, and she said, well, in this office, Mike, periodontal disease is totally acceptable. And boy, that was a big bomb we dropped in that meeting. When the older doctor said, who was in his 70s, blew up and said, that's not true. That is absolutely not true. And I said, well, doc, and I asked the hygienist, what percentage of patients in this office do you think have periodontal disease? And the hygienist quipped up and she said, there's at least 90% of our patients have periodontal disease in our practice. And the older doctor goes, that's not true. It's not accurate. There's no way that 90% of our patients have periodontal disease. And I said, okay, doc, what percentage do you think it is? And he looked at me right in the face and said, it's not more than 75%. I said, okay, so 3/4 of your patients have periodontal disease, and that's acceptable. And the problem is because there is no set standard of care. Every hygienist, obviously, the hygienist that was much older and more old school, so to speak, and not up on the more modern approach in the practice, basically, she was letting a lot of things go. 4s and 5s and pockets and a little bleeding, a little mobility here and there. No big deal. Let that go. Don't recommend it. And everything was, a regular prophy in her mind, and so on down the line. Whereas the young hygienist, she was really proactive at presenting root planing and scaling and doing quads and getting that done, and she had a lot higher standard of care. All right, so you can see that that was something that we had to straighten out and fix right away, because without that, it was causing a lot of confusion in the practice among the providers, but also among the patients, because again, it varied from patient to patient as to from day to day, depending upon who they saw, what level of treatment they were going to get in the practice. All right, so you can see that having a standard of care and selling to that standard of care is critically important in your practice. So this is as an exercise you need, again, and you do this as a group. Ultimately, doc, you make the final call. It's your practice. You have to decide, what's optimum in your mind and what's best and how you want treatment presented. All right, but again, you can't have it just be in your head. It's got to be shared with everybody, and we all have to approach it that way. And again, we're not looking for agreement with everybody. This is, again, not a democracy. We don't get to vote on what you think of what the best standard of care is in the practice. You set the bar for this in the practice. And if you have other hygienists that are there and some that are not agreeing with this, if they're not going to step to the plate and raise their game in terms of how you think its optimal treatment should be, and how healthy we keep our patients and how we're going to present and sell dentistry, all right, then they may have to make some changes there. All right. So again, this is a huge area in practice. A lot of confusion comes up, a lot of upset comes up, and again, it impacts the patient as a bottom line. Again, this is a really good foundational thing to put into your practice. Having your set standard of care that we all agree on and are working on together for the betterment of our patients. Right, and this becomes policy in the way we do things in our practice. Remember, there's different types of policy. Talked about this before. Again, this is an operational policy, having our set standard of care. And again, this is a great tool when you use in selling. When you're sitting down and doing treatment presentations as well, this is a huge thing as well. Having a tool to use to let people know when they ask you questions, why we can't cut corners here, or why can't we do it lesser like this, or why is it this way in our practice, why does it cost so much? You can explain to them, here's the why. The standard of care is why in your practice, and this sets the tone again for the materials you use and the lab that you use, and that's great. And if you have a high standard of care, this is going to increase the price, because it takes money to provide that kind of quality in your practice. And if it's a little lower standard of care, fine. You're running a clinic and you really can't afford, because of overhead and other reasons why, to have the standard of care be that high, then so be it. All right. But again, whatever it may be, there has to be a practice-wide decision on this. And this will be a huge freeing thing, very helpful thing, educational thing. It's really a guiding principle in your practice to use. All right. So I hope this was helpful to you. If you're enjoying these series, as I said before, please share this with others. And I'll be back before you know it with episode 38.